The Dana and Park Show is sponsored by Dr. Tiggs Center for Nutrition. Call 913-814-8222 and schedule your consultation today.
When I used to get massages, it would be one of those things where it was a treat. I became a member of Massage Envy Spa because when I'm looking to just relieve the stresses of the day or my job or the kids, it gives me exactly what I need when I'm looking for that reset button.
Unplug more often and every month with a Massage Envy Spa membership.
9 convenient Kansas City metro area locations.
Need a new roof or a repair to your existing roof? I'm Whitney Coulter with Buck Roofing and Construction. We are certified installers in both residential and commercial roofing, including CertainTeed, one of the nation's largest manufacturers. CertainTeed offers great products with outstanding warranties, whether it's just a repair.
All right, we go now to Atlanta, where Dr. Tom Frieden is taking the stage.
To be asking questions in the room, that you wait for the microphone so that we can hear that question. Our first speaker today is CDC Director Tom Frieden.
Thank you very much and good afternoon. Today we are deeply saddened by the death of a patient in Dallas. Despite maximal interventions, we learned today that he passed away. And our thoughts go out to his family, friends. He is a face that we associate now with Ebola. Since the start of the epidemic, 3,742 patients in West Africa have been documented to have died from the disease. We don't have their faces as prominently in front of us, and we know that even more people have been affected. So we think about this and we remember what a deadly enemy Ebola is and how important it is that we take every step possible to both protect Americans and stop the outbreak at its source in Africa. One of the things we do to protect Americans here in the United States is to improve our preparedness in our healthcare system. The 3 key steps are: first, thinking of the possibility of Ebola and identifying who may have the disease so that, second, they can be rapidly tested, and third, effectively isolated. That's crucial for our response. And identification, diagnosis, and safe care of anyone who may have Ebola needs to be top of mind right now for healthcare providers throughout the country. At CDC, we do quite a bit to support healthcare workers in addressing and assessing patients. We've provided detailed information that should be available to every frontline healthcare worker about how to address a patient who may have Ebola. Anyone with fever should be asked if they have been in West Africa, specifically Guinea, Sierra Leone, and Liberia, in the past 21 days, and if so, rapidly isolated, fully assessed, and if appropriate, tested for Ebola. We provide something called Health Alert Networks, which reach hundreds of thousands of healthcare workers. We do webinars. We reach out to professional associations, hospitals, emergency department associations, medical associations, and many others, so that we can ensure that the available information is up to date and useful. Right now, the bottom line of what we're talking about today is that we're stepping up protection for people coming into this country and for Americans related to travel. We will continuously look at ways that we can increase the safety of Americans, and we do that at many different levels. We do that in Dallas, where officials there are working intensively to monitor every person who might have had contact with the index patient to ensure that if they do develop fever, they're immediately isolated and the chain of transmission can be broken. We do that in our healthcare system with the kind of outreach I've described, so that patients will be rapidly diagnosed and, if found to have Ebola, rapidly and effectively isolated. We do that at the source, understanding that until this outbreak is over in West Africa, whatever we do can't get the risk to zero here in the interconnected world that we live in today. And we do that